Good day everyone! I am Neycelle Ruiz and we are Group 3B from DN3C. Today, along with my fellow members Ramila Parreño, Francine Ramos, Ysabel Regollo, and Kenny Sabusap, we will be presenting our research poster in our study entitled Clinical Readiness Among Nursing Students on Simulation-Based Training.
As outlined in the purpose section of the poster, this research study aimed to investigate the effect of simulation-based training on the perceived clinical readiness of nursing students within the operating room environment. The study aimed to investigate the effect of simulation-based training on the perceived clinical readiness of third-year nursing students in the operating room. The study was able to determine the level of perceived clinical readiness of third-year nursing students in the operating room pre-exposure and post-exposure to simulation-based training in terms of knowledge, skills, attitudes, as well as identifying the presence of a significant difference in the level of perceived clinical readiness of nursing students in the operating room before and after intervention.
To achieve this, we employed a quasi-experimental design, specifically the one-group pretest post-test design. Quasi-experimental research is used to evaluate the impact of an intervention or to establish a cause and effect relationship between independent and dependent variables, employing various methods to collect and analyze data. Furthermore, according to Capelli and Anastasi in 2024, the one-group pretest post-test design includes three components: pretest measurement, intervention, and post-test measurement. Therefore, a pretest conducted through a survey questionnaire was administered to a specific group of participants before their scheduled exposure in the simulation laboratory to gather data on their clinical readiness in the operating room. Furthermore, the exposure in the simulation laboratory serves as an intervention, followed by the post-test, which was administered to measure their clinical readiness in the operating room after their exposure in the simulation laboratory.
Our study focused on a sample size of 56 out of 98 Level 3 nursing students from a local university in Bacolod with scheduled sessions for operating room simulation during the second semester of academic year 2025 to 2026. We utilized a stratified random sampling technique to ensure the representation and power analysis was applied to determine a sample size that maintained a 5% margin of error. The data collection was facilitated by a modified and adopted version of the Nursing Practice Readiness Scale by Kim and Sheen 2022. The items of the modified and adopted version were restructured and mapped onto the knowledge, skills, and attitudes framework by Benjamin Bloom. This framework serves as the three domains that assist educators in creating learning curricula that allow learners with basic knowledge to evolve into individuals with higher order thinking and mastery, as stated by Gilbert et al. In 2024. As illustrated in the poster, the instrument proved highly reliable and valid, with validity at 4.64, interpreted as excellent, and reliability coefficients exceeding 0.88 across the dimensions of knowledge, skills, and attitudes.
Our results and discussion yield several significant findings. Prior to the intervention, participants demonstrated an overall moderate readiness, though they specifically scored high on knowledge, skills, and attitudes, with attitudes garnering the highest mean prior to the intervention. Following the simulation exposure, there was a measurable improvement across all three critical dimensions, which are knowledge, skills, and attitudes, with knowledge and attitudes entering the very high category, and attitudes remained the highest among the dimensions, followed by knowledge and then skills. The data confirms a significant difference in clinical readiness levels pre- and post-exposure, with students successfully transitioning to a high readiness status.
In conclusion, simulation-based training resulted in a statistically significant increase in perceived clinical readiness with a large effect size. We conclude that simulation is an essential teaching and learning tool that substantially enhances student nurses' perception of their own professional competencies before entering actual clinical practice. Thank you for your time. We invite you to scan the QR code located at the bottom right for a full list of our research references.